Hello, everyone, and welcome to today's training, Family Therapy, a culturally sensitive modality when working with immigrant Latino families. You can see my screen? No? And Marie, can you give me access to the screen? Okay, perfect, thank you. Today, our speaker is Dr. Isabeles Echevarria. We want to remind you that the MHTTC network uses affirming, respectful, and recovery-oriented languages in all our activities. This presentation was prepared for the National Hispanic and Latino MHTTC under a cooperative agreement with the Substance Abuse and Mental Health Services Administration, SAMHSA. All materials appearing in this presentation, except that taken directly from copyright sources, are in the public domain and may be reproduced or copied without permission for SAMHSA or the authors. Citation of the source is appreciated. Dr. Isabeles, our speaker, is a clinical psychologist. She obtained a certification as interpersonal psychotherapy clinician, was trained in trauma-focused cognitive behavioral therapy, family therapy, and neurofeedback. She completed a postdoctoral fellowship at the Community Service Institute in Boston, Massachusetts, where she provided home-based and school-based psychotherapy for communities of color. She's the training and content specialist for the National Hispanic and Latino MHTTC at the Universidad Central del Caribe School of Medicine in Puerto Rico. Now with Ed Marie to do the poll questions.
Hello, everyone. Let's do our first poll question. Familismo is a cultural theme present in all Latinx families. Please select true or false. Remember, everyone, you can click on the answer presented on your monitor. Thank you. The results are in, and it's 64% true and 36% shows false. Second one. Familia Adelante is an evidence-based program. Please select true or false. We have 79% true and 21% false. And the last one, therapists working with Latino families must be able to understand acculturation. And again, please select true or false. Sorry, we have 94% responding true and 6% false. So I leave you with Dr. Isabeles to continue her presentation. Thank you very much.
Thank you very much, Marie, and also thank you very much, Christine. Thank you, everyone, for being here for today's presentation. There is no conflict of interest during this presentation. I work for the National Hispanic and Latino MHTTC. And also, I just want to let you know that the National Hispanic and Latino MHTTC provide training and technical assistance for mental health providers working with Hispanic and Latinx providers. Christine, can you show the presentation? I cannot see the slides. Okay, thank you. So I hope that during this presentation, you're able to learn a little bit more about those specific cultural values that we can observe in some of our Latinx communities and Latinx families that we're working with. And also talk about what it means to be a culturally responsive therapist that is providing family therapy. And I'm gonna be talking about a case where I use a family therapy intervention, and also we can observe how we address or how I explore or address the different cultural values with this family. And I hope that this presentation could help you understand a little bit more about our Latinos and be open to provide family therapy services for a lot of our Latino families and communities that I think there's so much need of the integration of services and not only provide individual therapy, but also have the space to provide family therapy. So family-centered interventions include that talks about how we can provide services to family, but when we are talking about Latinos, is mostly how we can incorporate different or explore different cultural values that the community we're working with, they can have those values. And the first one, I will be talking about familismo or familism. And usually when we are talking about family therapy, we need to talk about familism. And it refers to the value that our Latinx community or Latinx family could present, and talks about how important is the family for this person, how important is the family for this child, and how the family could be seen as a protective factor for this individual. And sometimes we observe that depending on the acculturation levels, we have some families that lack of this value. And if they lack of this value, they can present more symptomatology than other families that if they don't present this value, they can have more symptomatology than other families. So how we can measure familismo in the families that we're working with, and how this can help us as clinicians. So there are different things how we can measure. We can measure familismo in a structural way, and when we talk about structural, it means is the physical proximity to family members. How we can explore this is we can check it out if our family live with extended family in the same home. Usually la abuela, tia, or we can have al padrino also like living in the same house, or the proximity also could include if they're living near their house or near their apartment. The next one is the behavioral, that is the behavior in relation to the family's values and expectation. And it could happen that we have different generations in the same families and they do not share the same values. So this could start creating some conflicts with the family that we're working. And the next one is the attitudinal familism measures, that are the individual thoughts and feelings regarding aspects related to the familism. For example, we can see the next slide that it talks about a specific the 4 specific attitudinal components that are inside the familism. Okay, so the first component means that believe that family comes before the individual. So what does it mean? That I think that you can observe that sometimes there is a mom in the family that is taking care of everyone in the family. She's taking care of the kids, she's taking care of the abuela or grandma, or she's taking care also of his brother or sister. And sometimes the moms, usually we can see that moms sometimes forget about themselves, and they say like the family come first, and they sacrifice their individual needs and desire for the sake of the family. The next one is the familiar interconnectedness. It means the belief that adults should keep a strong emotional and physical bond with their family. And sometimes that bond could be like they're open to ask for money if they need to. They share concerns about their health. Um, they are sometimes open to go to different places together. So they're interconnected. And the next one is the family reciprocity. And the family reciprocity talks about like if I'm able to take care of my mother because they say that she's sick and I need to take her to the hospital or take her to the doctor. So that reciprocity means that I would expect that my mom do the same for me if she can do it, or other family member can do the same. And the next one is belief in the family, in familial honor. So when let's say there's conflicts between people outside of the family, if someone is talking bad about this family member, they feel that they need to defend their family and to say something about it. So that's what it means, the belief of family honor. So why we're providing these concepts is because if there's conflicts between a family regarding, oh, I always there for them and no one, when I need them, they're not here for me. So we need to be really careful of if those values or components are part of the conflicts that our families are experiencing. The next slide, we can see the different values that could be present in our Latino families. Not all of our Latino families could present these values because it depends on the acculturation too. So that's something that we need to explore, and I will talk a little bit on the next slide. Sorry, my throat today is not working. Okay, so the first value is respeto. And respeto is based on the importance of respect and obedience to authority and to maintain that harmony. I always say when we're working with families, let's try to explore what respeto means for this family. Because not always respeto means the same for the children than for the adults. We can have difficulties like there's sometimes children say, oh, my mama was saying I'm faltándole respeto, or I'm being disrespectful for her and I don't understand why. And sometimes the mom saying like, no, you're always talking back to me, or you don't listen to me. So for them, maybe that's falta de respeto. But for the little ones, that doesn't mean falta de respeto. So we need to check it out. What does it mean for the family that we're working? Personalismo refers to the importance of cultivating warm and caring relationships over formal partnerships. So how a clinician can explore or use this value is when we respond to clients' questions regarding where are you from, why do you speak Spanish, where do you learn to speak Spanish. So that's how we start using this value. And this value is really important because it helps to increase trust in the therapeutic relationship. Then we have some gender roles, or sometimes let's say really stereotype gender roles that impact how the family see themselves, and how sometimes it impact the guilty that maybe a teenager could experience. For example, we can have, if we are working with adolescents that were sexually abused, and they think that they believe in Marianismo, that is one of the stereotyped gender roles, that they need to be pure, they need to be a virgin, and if they were sexual abuse, they can start feeling like they're not they're worthless, and they feel guilty about it. So that's why that value needs to be explored, and what does it mean to this family, what does it Marianismo mean, and also Machismo, and how we can challenge those beliefs about virginity, or being a person, or a woman that always say yes to everything even if they don't want to say yes, or when the woman just like need to be nurturing everybody and not taking care of herself, or thinking about her own, let's say, her own desires. So the next one is spirituality. So spirituality could bring a lot of conflict in families if their family are practicing different religions that are not really frequently used in the Latinos culture. Let's say Hinduism, Buddhism, Islamism. So those religions are not usually frequent in the Latino community. And if they do not share the same, it could be a conflict. But in the other hand, it also could be seen as a protective factors, because usually when we talk about with families, they have so much spiritual belief in, and it helps them to explain the reason why they're feeling this way, or sometimes it provide hopes for them. It could provide an explanation to the symptoms also that they are experiencing. There's another value that is not here that I just want to say too, is fatalism, or fatalismo in Espanol. And fatalismo is that belief that things happen to me because God wants that to happen to me, even though they're like really bad experiences or traumatic experiences. They believe that if that happened to me, I deserve it, and there's nothing can change this. Okay, so if they're experiencing some depression symptoms, they're really sad, or they're feeling really scared or nervous all the time, so they think that they deserve to be feeling those symptoms. So that's why fatalism also we need to bring this to the table and talk about what does it mean, and let them know that, God create a lot of things, and therapy is one of them, and therapy could help you to process your feelings, and you can implement some coping skills so you can deal with, I don't know, with your nightmares. You can try to understand and manage the anxiety that you're presenting. So there are other cultural considerations that needs to be addressed. And the first one is acculturation gaps. Acculturation gaps means that, let's say, we are working with a first generation immigrant mom, and then we have a third generation grandson or daughter, right? if they're in the same nuclear family, they could present a lot of issues because they believe sometimes they're really different. And some of the things that could be a conflict is the language. There's so many, so many conflicts in the families because sometimes the kids just not want to talk in Spanish at all. They just want to talk everything in English. And then you have los abuelos or the parents say like, in this house we talk in Spanish, or en esta casa se habla en español. Okay, so those are some of the things that we can observe. And the acculturative stress. I don't know, right? When I talk about acculturative stuff, I think about myself too, because when I moved from Puerto Rico to Boston, I think it was like really hard to understand that individualistic worldview. And here in Puerto Rico, we are more collectivistic. That if we want to go out with a friend, just call them, or with a family, just call them, and they get to your home, and we do a celebration and things like that. But when I was there, it wasn't like that. Everyone is kind of working on their own world, thinking about, I don't know, going to groceries, getting back home, and not gathering a lot, just like a lot of people used to do when they were in their countries. So those are the things that impact the stress that the family could experience. Also, another thing is like when you move to another city or another country, sometimes it's really difficult to know where I can look for different services. And we don't know where I can go to, which church I can go to, or if I want to eat Mexican food, where I can find the Mexican food that I like. So those are the things that impact that are part of the acculturative stress. The immigration journey. I think that the immigration journey is a topic that needs to be addressed. I would say not right away, because a lot of families do not trust in the system, do not trust clinicians. They don't know what you're going to do with that information. So usually they will not talk about that during the first sessions if they are not have documents, right? They don't have a visa and things like that, because they feel that you're going to share that information. So I think that for exploring the immigration journey, one of the things that is less threatening to them, I would say, is the genogram. And you can do a family genogram with them, where you can explore not only their mental health conditions, you can explore the relationship between them, you can explore the medical conditions also, and you can explore where they're living. And maybe using that will help you to introduce the topic of the immigration journey, and it could help to help them feel less stressed about talking about this topic. So always ask about that immigration journey, because I think you will gather so much information that will help you to understand of the symptoms that the family that you're working with may experience, or the concerns, their fears, their anxiety. And the last one is the parenting styles according to values. I think parenting styles, but also childbearing practices, is something that we need to ask first with our parents, because if we're delivering therapy and services, sometimes individual and family, the family have a specific values and parenting styles that are different from the ones that we are bringing. So let's start by exploring what are the discipline practices that you usually try to do. What are your goals in childbearing? What do you usually do? What works and what doesn't work? I think we need to be open for this, because I cannot start with a family and say, okay, let's practice, or let's do time out with this kid, and explain everything to the mom, and she was like, no, this is not for me. I don't like that. So that's why I always first try to talk to the parents and have a conversation, a plática, about different discipline or childbearing practices. So I don't know if everyone can write on the question box. I have a question for all of you. We can go to the next slide. If you can share, part of the reasons of why Latinx request family service, or why your Latino family requests family therapy. If you can provide some examples, or what are the main reasons for the referral. Sorry, while you were writing, I would talk about family-centered interventions, right? When we talk about family-centered interventions with Latinos, we means like to understand and to look out for what are the risk factor and protective factors, but also what are the barriers present in the Latino communities that could impact the delivery of the treatment delivery. And also, um, there's different programs that I will explain on a few slides later, where it is explained that when we are working with kids and children, it is really useful to provide family therapy, because when you just teach a child, just let's say deep breathing, right? We take a deep breath and inhale and exhale, right? When you teach that to the kid, you will need a parent in their home to remember them, like to remind them, like, okay, let's go to practice deep breathing. But if you don't do that, I think the therapy it will take longer for the kid to learn those skills that you are teaching. So that's why one of the reasons, so why it is so important to have family therapy with some of our children or youth. I don't know if Marie, there are some responses.
We have some answers here. We have children's behavior, grief and trauma, teenager utilizing illegal substances and experiencing depression, relationship issues, miedo, the fear. And aquí, okay, let me see. At my clinic, it's often after an emergency room visit because of safety concerns.
Safety concerns.
Another one, barriers present in the community is fear of information being shared with the authorities. Our programs are offered in Spanish and we don't report lack of documentation, but some families are still nervous about treatment.
Yeah.
Geographically speaking, there is some type of Latin cultural influence in most families I work with. There is a large mixture of Latin, Native American, and fusion of American culture. Another one we have it's generational gaps in accepting mental health services, family dynamics disrupted, trauma, domestic violence, or substance abuse in the family. Witness to community violence, victims of assault, traumatic loss and grief.
Okay, great. We have a thank you, Marie. We have a lot of trauma and grief, and I just want to say that the diagnosis of PTSD is really prevalent in the Latino communities, as also in the Native American and African American. So the trauma experiences that a lot of our Latino family could experience could go from the back, like intergenerational trauma, also historical trauma, or also during their immigration process, they experience a lot of traumatic experiences. I just want to share also with a family that I'm working with, where we're living in South America. They have to travel from South America to United States. So during that journey, it was really traumatic for this family, and also because the mom once was arrested by ICE because she was crossing the border from Mexico to California, right? And she was arrested. So I think that we have a lot of families experiencing so much fear to the systems and a lot of traumatic experiences that we need to look out for when we are delivering the services. Okay, so another thing is like a lot of families that are Latino, there is so much secrets or secretos. So I think that in therapy we need to talk about also those topics that nobody in the family wants to talk, that sometimes are affecting how they relate to each other. Okay. Thank you for sharing all your comments. On the next slide, there are different, right? Families-oriented therapy maximize the effects of intervention for adults and adolescent Latinos because family build bridges, right? Family is the first community or the first people that kid is sharing and learning about the world. And what is the role of the therapist here? The therapy will need to first psychoeducate about what is therapy, provide psychoeducation about what are the expectations during our family therapy sessions, how often we're gonna meet, what are the boundaries here, justify the conflicts, translate family members' cultural behavior, understand that sometimes if you're not Latino providing services for Latino, if you don't understand the dynamic that they're having, or for example, they talk really loud to each other and you were like, okay, what is happening? Are they angry or not? Because they are talking really loud and you don't understand. You can talk about, are you saying that you're talking really loud? Is this usually happen in your house? Are you angry? Or if someone in the family feels more angry because someone else raised their voice? So there's something else that, that we can explore with our Latinos. And encourage compromise and negotiation. Always negotiation, it helps like to hear everyone voice and also try to find everyone in the middle where everyone could feel safe in their home, so everyone can feel like they're listening to their feelings and their expectations too. So I would say that the family therapists have a huge role when serving Latinos during therapy. So on the next slide, there is some evidence-based practices that were developed specifically for Latinos. Okay, I think we need to be really unique as a provider. You need to know which are the culturally sensitive family therapies for Latinos that are out there. And I also added the websites where you can find more information or you can share. Also, you can check it out if you want to receive training of those different family therapy. Some of them usually try to work with externalizing and internalizing behaviors and to address a range of youth problem behaviors like substance abuse, delinquency, antisocial, and aggressive behaviors. The last one is here that we have Familia Adelante. I know that was one of the questions. It is a evidence-based program that can be applied in a universal prevention setting or in a more target selective prevention approach for youth at risk. This is a program developed by Richard Cervantes and the network. We also have a training on this listening session on June 10th. So stay tuned because we are gonna share the information through our social media. So just to let you know that there is more training about Familia Adelante, so you can learn a little bit more about what does it mean and how you can get more training on it. When selecting a treatment model, we need to be really aware of if it is an evidence-based, if this evidence-based, if they use a sample with a sample that include minorities and specifically Hispanic or Latinos in that sample. Also, we need to learn more about the treatment manual. And I would say we need to try to check if the model that we're choosing is the model that we work with the family that we are providing services. Because I would say not every model will work with every family. Also, let's check it out if the model that we choose, they have some adaptations for Latinos. For example, the trauma-focused cognitive behavioral therapy, that it was a model developed for Caucasians, right? But there is some modification to that model that could be implemented for Latinos, children and youth. We can go to the next slide, please. And what family therapist competencies, what we need to have, right? We need to be open, and we need to try to take extra effort to build that therapeutic alliance with our clients and understand the origin of the different family issues that they're presenting. For example, I had a family where it was a grandmother taking care of 5 grandchildren. One was an adolescent and 2 were adolescent, and the other one was from 5 to 10 years old. So this family, it was so different from what we usually see. There's a grandmother that taking care of 5 grandchild, every each of them, they were females, right? And how the expectations from the grandma, because of her trauma history, because of how she was raised and her cultural belief, impact the children, that they prefer to speak in English in the house, they prefer to be on the phone almost the whole day, they prefer to stay at their own rooms and not share with the grandma in the living room, let's say. So for me as a therapist, I observe that there are so many conflicts in this family, where I also need to be open to explore what happened to the grandma. Let me explore if there was any traumatic experiences that happened to her that impacts her childbearing practices with this family. And the next slide also continues to talk a little bit more about the importance of the different stress and protective factors that we need to explore with the families that we're working with, and family expectations. Family expectation values and their fit to the process of therapy. Not every family is able to have family therapy, because if we have a really dysfunctional family, or there were some sexual assault or sexual abuse or physical abuse in this family, I think if there wasn't resolved, or they were not in treatment, individual treatment, it's not going to be helpful, because you're going to have one of your clients going to be more agitated or more anxious, and it's not going to be helpful. So if this is something that is happening, it's better for them to start with individual therapy and process their own issues in individual therapy, and then have family therapy. So what else do you think a family therapist may take into consideration? I think that if you can write on the chat, on the question box, what else do you think a family therapist may take into consideration when working with Latinos? I don't know if you have some answers here, Mari.
Oops, sorry, I was muted. Okay, we have here how I think it's how can Latinx and non-Latinx providers get an understanding of our culture without furthering stereotyping our communities? As in, understanding our community is very important, but how can providers understand without being biased? I think that's a
Okay.
question. We can discuss it later if you want. I can read you the other answers. Family
Yeah,
schedule, availability to participate in therapy as a group, hesitancy to trust in intuitions. We have those so far, and the question I already read
okay, sure. So I can ask.
about bias.
So when we are working with a family and we are serving different patterns, and I think that it's okay to ask the question, and I think it's more not about asking the question, it's more about how we ask the question, right? um, because if you're seeing something, I want you to trust that gut feeling and that experience that you have and your own experience, because it seems like, okay, this something is not working here or something that I don't understand. So you can be open, like, to talk about, let's say, I'm observing that the communication, that you're not communicating openly with your mother, and you're talking straight to me, right? So you can ask, like, is this always happen in your family, or do you talk with your mom during when you're at home about different topics, right? We can address that. We can provide that communication, and then we can also address that in the therapy session, asking different questions, like more open questions. But another thing is, I would say, is like to learn or write or read, sorry, or read more about the Latino culture. There is a really good book from, I will share this book, Latino Families in Therapy, from Celia Palico, Latino Families in Therapy. This is the name. And it talks about specific cultural factors and considerations that you need to have when you're providing services to Latino. So I was encourage everyone to read more, to learn more about the specific the specific values, and if you have the trust of your client, they're not gonna feel like if you're judging them, you know. There's another question, Mari.
We have feelings about having a family left behind their country of origin, feelings about family members who were deported, dealing with discrimination and stereotypes from others around them, male trauma, which is often never addressed, male participants, lack of transportation, extra system pressures such as social demands or educational demands on the children. Also, I work with youth who, regardless of culture, tend to gravitate toward things that might cause them issues such as street identity, substance use, peer pressure, etc.
Okay. Yes. I think when they say male trauma, not a lot of clinicians are able to work with male trauma and not address it inside the family. So I think that's thank you for sharing that. Thank you for bringing it up. And social demand, education demands too. I think that are things that we need to take into consideration when we are providing a therapy. So the main goal of therapy is to help our families to recover from the stressful or conflicts that they are experiencing, right? And when we have that goal, so you can recover, you can heal from those traumatic experiences or difficult situation. I think that brings hopes to the family too, when you let them know that if that is your primary goal, to help them to, I know that usually we say to decrease the symptoms, to increase emotional regulation, but I think that it goes further, right? And we hope that they are able to manage their emotions, but also they're able to heal those traumatic experiences that they could experience through immigration, or also now they're living in the United States. Okay, so there's also explore pain and loss associated with the separation, just someone mentioned. And one of the things is like we can observe that when parent moved to the United States and the child stayed, let's say, with a grandma or the mother, sometimes the one of the family member requests the child or contract a coyote so they can go to the state. There are so many traumatic experiences that the children and the family could experience through their journey. So that's really important. And also explore how the child felt when he moved or she moved to the United States with that father or mother. Because usually they were thinking that I'm worried about my grandma that is in El Salvador, or I'm worrying about my grandma that is in Guatemala. I don't know if she's eating. I don't know if she's able to go to her doctor when she's feeling bad. And I think those are the things also we need to explore, who was left behind in their country and why they want to, how they can process those feelings inside the therapy sessions and continue to reconnect. The next slide talks about culturally responsive therapies provide leadership, support, and also guidance to the family that we're working with. And we need to acknowledge that there's like a struggle, right? There's an adaptation to new world, having into consideration how I grew up and adding new rules, new values because of the values that the United States have. So that is a process of growing, of change, of adaptation that it hurts sometimes, right? And also be aware that acculturation could be associated with less effective type of parenting. So the more acculturated the family is, the parenting practices that they can implement sometimes is not useful. I know and I have seen with my clients that sometimes the parents start to pay more attention to something more, to something more specific, like I want you to go to school and I want you to do your assignments, and that's the main goal, to do your assignments. But they forget about having to spend time with them, or they forget about sitting down, just talk or play a game, or just like play dominoes or things like that. So they forget about those things that are really important. I always say that the language of children is playing. So if you want to connect with them, you need to sit down on the floor and start playing with them. And that's how you're gonna know them a little bit more. So sometimes the parents forget about that and they just start paying more attention to work and not about establishing that emotional connection or developing those areas of the child or adolescent. Also, we need to consider parent-child conflict and the possible impact of acculturation-related issues, just as I explained. The next slide, please. And also to know that the young children are acculturated faster than their parents. So we have children that are already like reading and writing and speaking in English, and parents feel ashamed because like, I don't understand English. I don't know what they mean. I have so many trouble when I go to the physician, or when I go to the mental health, or even when I'm ordering something on the phone. And they this is how we see it, that the younger children acculturated faster, so that will be more conflicts in the homes. So when Hispanic and Latino families find therapy's views acceptable and relevant, or when they establish that connection with the client, I think that's so powerful, because we know, right, there is so many health disparities, and I say I would take advantage of the clients that I have, because I always congratulate them because they're in therapy, congratulate them because they have been brave, and to say like, yes, I'm going to a therapist or a psychologist or a counselor. So I always appreciate that they have the courage to go to therapy. On the next slide, we can go to the next. Okay, there. So when you are connected, if you as a therapist have that connection with that family or the client that you're working with, it helps to or also if you're providing services that take into consideration the cultural values or cultural themes. You're a therapist that asks about what holidays do you celebrate, or there are specific dates during the year that are special for you or that remember you of your country. Let's talk about it. What you did is something that we can add it to our family meetings or family therapy sessions. So when you try to go extra, right, the client will feel appreciated. They will feel that you know about the culture and that you're willing to learn more about it. That could increase treatment outcomes a lot. They could feel like less guarded and more open to practice the skills or the strategies or interventions that you're providing. On the next slide talks about the family therapist will help families to create a new and effective blueprint for parenting that integrates new and old ideas and help them figure out how to effectively interact with schools, community institutions, and when we say community institution, could include church, could include community centers or tutoring centers, right? Or if there is practicing a specific sports too. So it's like to help the family to interact with all the systems, okay? And I think it's beautiful to see when you start working with a family how the family practice the different skills or techniques that you teach them, and how you help that family to feel more welcome, right? To feel that even though if they're coming from Mexico, they're coming from Guatemala or El Salvador, they can still have, they cannot forget about who they are, right? Where they came from. That is important too. And how we can integrate my cultural values, and I can add the new things that I'm learning and norms from the place where I'm living with, and create a new me, right? A diverse me, let's say. So I will present this case, and I think this provides some examples of how the family value was integrated and explored. And this family this is not her actual name. The name was changed because of confidentiality, and I changed other things just because of confidentiality too. So let's talk about Marcela. Marcela, she was 6 years old when I started working with her. She was living in California, and both of her parents were from Mexico. And she was at first grade. She was living with her mom in a studio apartment. And she had three older sisters and one brother that passed away. Her brother passed away because he was diagnosed with cancer. So he was just like, I think 3 years old. He was a baby. So after the brother died, the family separate. So it means that the mom and the father were not together. After the brother died, it was really traumatic for this family. And then the girl started seeing the father like 3 times a week. First, she started to receive therapy after her brother passed away and she was 3 years old. She started to receive TSCBT. And one of the things that it was that we need to take consideration is that father was not included in the therapy session before, during the TSCBT and other sessions. He wasn't included. And some of the things of why he wasn't included is because when the clinician met with the mom, she was always saying bad things about the father. That he was really violent, that he was really angry all the time, and he was saying things like that. So the therapist did not feel. The therapist did not feel comfortable to inviting the father. So one of the things that this girl was experiencing when I met with her, one of my goals was integrating father into therapy. And first, meeting with the father alone, then meeting with the mom alone, and also meeting with all of them, just to explore a little bit more about what is happening with this family. So the girl, Marcela, she presented several trauma symptoms, including sadness. She was presenting difficulties to fall asleep. And the topic about that, it was a topic that usually was on her mind. And she was scared that something could happen to her mom. And it is related to her trauma history. This case we treated from a trauma-informed framework. We use our trauma lenses, and I want you to see it also with your trauma lenses. So she was experiencing a lot of crying spells, and sometimes also she was worried about going or visiting the father. And what we try to do is like we try to explore what's happening in this family, because there are so many secrets around the family that it was kind of confusing for me. So we can go to the next slide. I had a session just with mom, just to explore a little bit about her background. We did a genogram, and I think that was really helpful with this case because it helps me to understand a little bit more about who she was and about where she came from. So when we were doing the genogram, she explained to me that she was physically and emotionally abused by her father, and she was married before moving to California. When I was working with her child, she was working almost 7 days in a week, so she did not have like free time, let's say. And she was from Osaka in Mexico, and she speak not only Spanish, she also speaks Zapoteco. And after, one of the things that brought to my attention is like sometimes she is providing explanations about what's happening with the father or with the girl, but sometimes she changed that story. And that's why I was like, this is confusing. What is happening here? What is happening here? I don't understand. And I let her know one of her concerns is like father was not showing up to pick up the girl. And I say, okay, let's try, let's do something with this. Let's bring him. Can he come to therapy? Let's talk about it. How we can address this issue. Maybe we find a way to talk about it that could help you to feel less stressed, because she let me know that she went to the father pick up the girl like in a public space, and she said like I'm almost on my way to work. I go there, I wait for him, and he did not pick the girl. So I don't know what to do with her. I need to call my daughter. He had an older daughter. I need to call my daughter to stay with her with Marcela. So that was a huge conflict with her, for her. So I met with the father and explored a little bit about his history. He was from Osaka to Mexico. He has a history of substance abuse disorder and alcohol, and he was in prison for 10 years when he was living in Mexico. And when I just learned the reason why he was in prison, in jail, he explained to me that it was an accident where he was driving and he hit a man with his truck. So that's why he was in prison for 10 years. And he explained to me that while he was in prison, he stopped using substances and he became a Christian, and he moved to United States because when he was released, he had a death threat. So he said, I need to move here. So he immigrated to California. During the sessions with the father, I think that he was really open to share, and I was like, I understand, like he explained everything really clear, so I was able to understand. But also I have the space to talk about what was happening, how we can talk about finding ways so you can pick up the girl. I want to learn more about your history, about your family, and also we did a genogram with him too. So when we are done a clinical formulation, this is the 5Ps model. We explored what are the presenting problems. It was that Marcela was experiencing a lot of anxiety symptoms related to her trauma history and conflicts between her parents. They were always arguing in front of her, so that's something that really triggers her symptoms, and that's something that we address in the family therapy sessions too. Some of the predisposing factors was the family history of mental health condition, including depression. And I would say first trauma, right? There's so many complex trauma, historical trauma that both of them presented. Low economic status, that's why mom needs to work almost all the time. Father was taking care of an elderly, but mom was always working, and emotional instability at home made the client to worry more about the family, more about what is going to happen to my mom. And when she was with the father, she was worrying about what happened if something happened to the mom. And really scared anxiety about if the mom was okay. Then we have the precipitating factors. She witnessed several episodes of domestic violence between both of them, and the brother passed away, and constant conflict between both parents. The perpetuating factors include the ongoing conflicts, the tantrums that she was presenting, anxiety, fear, and nail biting. She presented tantrums because sometimes she don't want to stay with father, and because of her anxiety that she was presenting that anxiety that something could happen to mom. That's why she was always want to be with mom, but mom need to go to work. So the father was not just the only one that take care of the child. It was also her sister. They were like 20 something, and the father, both of them. So this family, the mother, another of the trauma experiences is like the mom accused the father of in some kind of way sexually abusing the girl, but then she retracted from that. And I think this does not happen frequently, but this was something that we also talk in the therapy session, that we need to really be really careful with that. But she said that that happened when she was a little girl, not at the time that I was working with her. So also what we try to do with this family is to explore what are the protective or threat factors that they present, and they include spirituality. For the mom and the father also, the belief in God, they were both Catholic. That was something that it was really powerful for them. They won't say that sometimes on Sunday she go to church, but she will say that she always praying for her family, praying for her daughter, you know, and her family also. For the family also be the value of familism, the importance of the well-being of the family was really important for the mom and for the father. And not usually the father is involved in taking care, and he was involved, and this is something that um that was court order, right? That he needs to pick up the girl 3 times a week and things like that. And that's also one of the reasons why my supervisors say, okay, we need to do this, we need to meet with him, and we need to explore what is happening and to explore his story, because usually his story was like never heard. So that's why I started bringing him to therapy and talk and exploring a little bit about his history. And also because I observed sometimes that mother change their stories so many times, and was like, what is real, what is not real. So that's what was some of my concerns. So for the girl, another of the protective factors is that she loved coloring. She was really empathic. She was so loving, and she was really smiling all the time when we were in therapy. And when you see that, you know that this child is happy to be here. And let's try to explore a little bit about what is happening, how she feel, and we try to provide some coping skills to manage her anxiety and also the worries about mom passing away. I provide not only individual and also not only family but also individual therapy, and we work to develop a therapeutic alliance with the family, and also try to mix a little bit with TSCBT, where she was able to identify emotions, realization, validation of emotions, and let her know that therapy or the office where I was and we were meeting, it was a safe space to talk about difficult topics or to talk about secrets, right? During the collateral interventions, I met with the father alone and we met with the mom alone. And one of the things that she explained to me, she says, siempre nos chocamos, yo a veces digo cosas para defender a la nena. And it's like we always have difficulties or conflicts about, sometimes I say things to defend my girl, right? To defend her daughter. And she acknowledged that sometimes she needs like to take a step back, right? And try to be aware that father was trying to be involved in the life of the child, but also be aware of the boundaries that she needs to create around it. We developed a contract of, because there were so many conflicts, and one of the conflicts was about picking the girl. So we developed a contract, and also the other one was about the clothes, because when the child was with the father, she bring, the mom said, I bought new clothes for her, but she left the clothes at her father, and she had to personal clothes and things like that. So we developed some rules and we wrote it down. We made copies so they both of them have it. And we explored the value of familia for each one of them, the familia, respeto, and also personalism. And the next slide, this is some of the intervention that we did with the father. And that I did with the father was to having the family therapy, include the father, right? Identify what they consider as the main concern that they will want to work with. Discuss also traumatic experiences that could impact how they talk to the child, how they talk to Marcela. We provide support to family members in staying home and caring about their own needs. The mom, one of the needs of the mom was to, I think she needs like clothes and things for her house. I think that I don't remember exactly if she needed like appliances or a bed for her, and we try to also check out what she need, and we connect her with an agency that provide that. And we provide psychoeducation about different type of communication. And we did this as a therapy session, right, together, where I presented and talk about different type of communication. I bring it like a game because the girl was 6 years old, she was little. So I bring it out as a game, and they provide examples, and the girl provided examples how they can communicate in an aggressive way, how they can communicate in an assertive way or passive way. And I think during this therapy sessions, one of the things that we accomplished is that we were able to identify using the structural family therapy that is a psychotherapy developed by Salvador Munition. And we focus on observing the functioning within a family and also the structure. And with this model, you are part to try to be there and to be in the family, but just to look how the dynamics of the family and consider cross-generational coalition, how the boundaries are between the family members. Okay, so what we address or notice in this family. The first one is that they present a cross-generational coalition, and it means that there's an inappropriate alliance between a parent and a child against the other parent, right? In this case, there was a coalition between mother and daughter against the father. We identify different supports like families and friends, and different stressors that include like watching or being a witness of the brother dying in the hospital, witnessing domestic violence. Mother was arrested also, and visitation days with father. So mother was arrested because she was shoplifting, and she was released the same day. But that's something that one of the main reasons why father was really concerned about the daughter, because she said like she was a pilla, or she was like a how you say, a person that robbed things, right? So we were able to identify those stresses that were repeated again and again through the verbalizations, father and mother. We observed that boundaries between them were diffuse, right? Diffuse boundaries, it means that they're not clear boundaries, and individuals have the problems to identify who they are and what is their role, right? So it affects the adaptation process, and also one of the things that we try to do is like she loves to draw, so I try to let her know, let's draw. Let's make a drawing about what do you want to express to your parents? What do you want to tell them about these conflicts, about how you're feeling, sobre los problemas, sobre las discusiones? What do you want to tell them? and she draw this. And she say, I love you, but can you take a break? Can you take a rest while you're talking? So I think it was really powerful drawing. And during one of the sessions, with family sessions, she was able to show the drawing to her parents and let them know that sometimes it was difficult for her to process what was happening between both of them. On the next slide, I have a video. I just want you to have this video if you can watch it on your own. I know it is an old video, but it is. I know that it's difficult to find a video where you can see a specific technique explained with real patients or clients, and I think you're gonna love this. This is a session with Salvador Munition and a family where he tried to understand what is happening in this family, and he explained he explained his what he sees and how the clinicians were working with this boy and how the mom sees the difficult problem. And in this case, the father was there in the room, but he doesn't know why the kid, he doesn't know. He didn't know why the kid was in the detention center. He didn't know, sorry for that. And I think that this is so important to be aware and to try to include the parents inside the therapy session if it is safe for the client and for the family, right? And also the mom, if it is safe to include too. So some of the accomplishment with this family, I would say, include that we were able to increase health literacy, so they understand what is therapy about. We talk about the boundaries and set clear boundaries, and help the family at least to talk about one specific situation, right? Because there were so many issues, right? And we talk about, I think that one of the accomplishment was that we were able to let them know that it wasn't okay to yell or to talk bad between each other in front of the child. So that was something that was also accomplished during the sessions. And the challenges was one regarding consistency because of her job or the father wasn't able, things like that. That was really difficult. Engaging both parents in therapy also was another of the challenges that we observed. I think we can go to the slide of recommendation and resources, Christine. Okay, so my recommendation, let's say after learning more about cultural adaptations, learning more about culturally responsive services, I noticed there are some things that that if I have this case right now, I will add to it. And one of them is the use of this implied cultural formulation interview, because it's a way where I can obtain information regarding how the families see the specific situation that they're confronting, if they received help before, or what are the things that the family did to resolve the specific problem. The recognition of specifically how the values affect parenting practices, and also explore a little bit about the process of acculturation and assimilation for them and also for the client. And I would, for this case, I would recommend like home-based therapy instead of therapy in the office, because it will help to decrease those inconsistency with the therapist. session. So some of the resources that the National Hispanic and Latino MHTC have for you is this one. This is the DSM-5 cultural formulation interview. This is like a brief review of what it is, and there's a link where you can find it. And also, if you want to receive training about CFI, you can go to the New York culturalcompetence.org, where you can receive that training specifically on how to use the cultural formulation interview. The next fact sheet talks specifically about the Hispanic and Latino values that I think we need, that is brief, right? And we need to have it handy, so that fact sheet will help you to understand, and you can print it out or put it near in your office, so you can go back to it when you need it. Or to share with your clients, like, let's say you have this value, what does it mean? Or if they're experiencing any conflicts, or if they lost that value during the acculturation process too. So the next fact sheet that we also want to share with you is the complicated grief, cultural considerations when working with loss in Hispanic and Latino students and their families. So there's a booklet where you can download it. It is for free. And there we have another resource for you, that is a trauma-informed care model for immigrant, Hispanic, and Latino clients, where it explains what is a trauma-informed approach, what are trauma-informed services, and how important it is to clinicians to be trauma-informed and cultural responsive when we are working with Hispanic and Latinos. There are other resources for you too, regarding where there are different like Project Fatherhood is a program. They help the parents to integrate the parents, to integrate the parent in the therapy, or integrate the parents in different activities with the child. It could be having a tea party, or going to a library, or doing different activities together. So those are different programs that help parents to develop skills to be more sensitive to their child's needs. So I will say thank you. Thank you everyone for your time, for your attention, and also for your participation. If you want to contact me, or you have any questions, you can write to me. This is my email. And also, I want to let you know that the National Hispanic and Latino also provide technical assistance to agencies, right? If you're working in an agency and you think you need more information regarding how I can apply cultural values, or providing trauma-informed mental health services to Latino, we are here to help, okay? So you can reach out to us and contact us, and we will be happy to help you. This is our survey. For us, it's really important your opinion. So if you can scan, or you can click the link, it will be so useful for us, because this is what it counts, so we can continue to provide more training like this one.
Isa, we have some questions. Sorry.
Yeah,
I have some
just
questions.
want
I
to say
don't know if you want to go answer that. First of all, thank you for a wonderful presentation. It was very interesting. First question, any advice for working traditional Hispanic families who have a child who is LGBTQ+?
Okay, so I know that one of the things that usually it is a conflict for the family is those religious belief of the roles of male, female, things like that, right? I think that one of the steps is to explore what are the values that this family have, and also what were the expectations that they had with their child. Because if sometimes parents say, oh, I want to have grandkids or go to your wedding or boda, they're gonna have a wedding, you know, and they they think that they will not have that opportunity, they will feel some kind of way, that that it wasn't the way that it's supposed to. So I think that we have parents that are more open, right? But when you say the more traditional, they have this stereotype, right? That this needs to be that way and nothing can be changed. Like, I think that how we can approach as a therapist is to explore those expectations and how those expectations change because of the choices that they made, right? And also, one of the things that I always say, like, we need to love our child, right? We need to love our child because they are our child. They're always going to be our child, right? And be sensitive to the parents, but also be sensitive to the young or adolescent. Thank you for that question. But I think like checking those expectations and also being able to explore that things change, you know, and things, it doesn't mean that are bad, things change, and the fluidity, right, of the situations, of the conflicts, and this is something that is part of them, but it's not everything about them, right?
Okay. Do you have resources you can share for parent psychoeducation on effective communication in Spanish?
Okay. Yes, I can share, but I will need to look for the link so I can share with you. Because
They can also write to you on your email if and they're asking to see your contact again, please. If you can go back in the presentation, that would be awesome.
yes, yeah, great. Yes, you can send me an email. So I will send you different links where you can provide psychoeducation about PTSD, about trauma, about different important topics.
We
In fact,
can do a last question. We have, you talk about the old and new parenting blueprints. What would typical parenting look like for a Latino family, and how is it different?
okay, so I would say all parenting, it's when I say all parentings, I would say like parenting childbearing practices that some of the countries have, just like hitting the kid or tirarle con la chancleta, or like using the ¿cómo se dice? La correa, using the belt to hit them. I think those are like old childbearing practices that maybe the parents use because their parent used those too. And I think we need to be aware of that and explain to our clients this is, cannot happen here in the United States, because if you do something like that, I will need to report you. And there's a lot of parents, they didn't know about those laws that are different from other countries. So I think those are specifically, or maybe like being beside hitting them with something, being physical with them, or not providing what they need, or also what happened too is like if the family have a business, they want the kid also to be in the business working. So that's something also that we need to say, this is gonna happen.
Okay, so we don't have time for everything else. We do appreciate that you took the time to do this presentation. It was amazing, a lot of information. valued information have been shared, and we have a lot of great comments and people thanking you. We shared your contact. You can write to Dr. Velez. You can write to our Hispanic Latino MHTTC email. And remember to fill out the evaluation form. It takes a couple of minutes. You can scan it. It's also in the presentation. If you haven't downloaded the presentation, in your control panel, there's a tab that says handout. You can download it from there. If not, you can write to us to the Hispanic Latino MHTTC network.org and we can send it to you. Thanks again, Dr. Velez. It was amazing and it was very good.
Thank you. Thank you everyone for your attention and participation. And remember that we are a tool, right? And we are here to serve others. And thank you for the work that you're already doing with our Latinos. Thank you. Bye.
Bye.